Hello friends, welcome to Chandrapith Homeo Edifications. Well, today we'll have a small discussion on the mitral valve prolapse, or you can also call it the myxomatous degeneration of the valve. It is basically a valvular disease of the heart wherein the mitral valve gets affected. Let's see what is the basic MVP called mitral valve prolapse. What are the signs and symptoms? How do we come to know that there is a valve prolapse? And what are the causes or the risk factors we'll look into? And finally, we'll discuss some of the very important homeopathic remedies that can help us manage the difficult symptoms of the valve prolapse. Well, friends, we all know the mitral valve is located in between there's a junction between the left atrium and the left ventricle of the heart. Now, what actually should have happened is during the systole, when the ventricles contract, the normal flow of blood should be out through the aorta to be supplied to all the body parts. But due to the myxomatous degeneration, what happens during the systole? Actually, the mitral valve, the flap of the valve, that gets thickened. So during the systole, what happens? That flap gets displaced into the left atrium, which therefore the mitral valve doesn't shut properly, and this allows some of the blood to leak back into the left atrium, which should not have happened otherwise. So this is myxomatous degeneration of the valve that leads to mitral valve prolapse, and the consequences as the mitral regurgitation, the leakage of blood back into the atrium. Now, mitral valve prolapse has certain complications. For example, the mitral regurgitation, as I just discussed, and it can also lead to infective endocarditis. Fine. It can also lead to congestive heart failure and even cardiac arrest, though it's rare, but it is a major complication. Let's have a look at the signs and symptoms. Well, friends, the very first sign and symptom that comes on during a physical checkup is the heart murmurs, right? The late systolic murmurs indicate a valve prolapse inside. And the mitral valve prolapse syndrome, as we call it, has certain specific symptoms, which include palpitations, which includes a stronger heartbeat, and which includes dyspnea on exertion. There are symptoms of shortness of breath on slight exertion, right? Then there is dizziness. The BP may fall low than the normal levels, that is low blood pressure is there. And then even the body mass index is on the lower side. There are certain ECG variations are observed. For example, the ventricular tachycardia, that is a straight indication of a valve prolapse. If we see the causes or the risk factors as such that lead to mitral valve prolapse, the first thing that comes to mind is rheumatic fever. In fact, rheumatic fever recurrence. These episodes during the early years can lead to valve prolapse in the later stages, the later years. Well, friends, with the advent of penicillin injections, the incidents or the episodes of recurrent fever are considerably lessened in the developed countries, but this is certainly a cause of concern for the developing countries and the underdeveloped ones. Now, apart from recurrent rheumatic fevers, there are certain other risk factors. For example, Marfan syndrome, for example, polycystic kidney disease, and even Graves' disease, that can lead to valve prolapse in the near future. The lower BMI indicates that the prolapse patients, the valve prolapse patients, are typically leaner, they are thinner as compared to normal ones. Let's come to the most important part of the video, some of the very important homeopathic remedies that come to our rescue to manage the difficult symptoms of valve prolapse, the mitral valve prolapse. The very important homeopathic remedies, to name a few, first and foremost, I would say apocynon. An excellent homeopathic remedy. We can use apocynon in the Q form, that we call as the mother tincture form, just 5 to 10 drops in some 1/4 cup of normal water 2 to 3 times a day. that can help us in relieving the difficult symptoms of mitral valve prolapse. Second very important medicine is cactus. Cactus as such is a gold standard remedy in homeopathy wherever we consider the heart conditions or heart troubles of any kind, particularly the valvular troubles here. Third very important medicine is Lauracerasus. Now where there is dyspnea, symptoms of shortness of breath, and even I talk of congestive heart failure, that could be a complication of mitral valve prolapse. Lauracerasus stands out of the crowd. That has excellent results I've seen with Lauracerasus. Next very important medicine is Strophanthus. Strophanthus is an excellent heart tonic as such, can be clubbed with other medicines to get relief from the difficult symptoms of mitral valve prolapse. And also I should not forget the role of Naja. Naja is an excellent medicine where there are valvular diseases of the heart with murmurs as very prominent symptoms. Naja 200 potency in dilution form can help us there. So well friends, these were certain very few but very important homeopathic remedies that can help us in the difficult symptoms of mitral valve prolapse. Do consult a physician before you arrive at the final prescription. I hope this video enlightens all of us regarding the mitral valve prolapse and its outcomes and very important role of homeopathy in it. Stay tuned for more such informational videos. We'll see you soon in the next video. Take care. God bless. Bye bye.